All right, looks like we've got everyone in. So we will go ahead and get started. Welcome everyone to our webinar on the ACE-15 survey tool, measuring teamness in your organization. Today we're going to talk about the assessment for collaborative environments, which is called the ACE-15. It's 15 question survey. And below on that slide, you'll see the attribution there. It was from the Oregon Health and Science Training University. And basically, it's a pretty basic user agreement. And so you're free to use this tool in your organization. Just don't sell it or say it's your own creation or something like that. And then thank you, Mariah, for putting that in the chat. If you have any questions or issues, you can message Mariah or you can email her at mblake@clinicians.org if you're having any connection issues or anything like that. Okay. So we are here. I'm here from the Association of Clinicians for the Underserved, ACU, and we started 25 years ago. We were started by alumni of the National Health Service Corps. And while things have changed a little bit over the years, our main focus continues to be to improve the health of America's underserved populations and to support the clinicians serving in those areas. So to that end, the recruitment and retention of a transdisciplinary team, we feel, is the road to achieving those goals. And hopefully this webinar today will present a really useful tool for your organization in helping to make sure that your workforce is satisfied and has a good environment to work in. So the STAR Center is the NTAP, the National Training and Technical Assistance Partner housed within ACU, and it's funded through HRSA. And our job is to provide all of these free trainings and resources for the health centers and PCAs. And so you can see all the smiling faces. This is the whole STAR Center team today. Several of them are listening in with us as well. And then today, that's me on the left. And then we're really excited to have our special guest with us, Katherine Brieger, who's joining us from Sun River Health. And she's going to be talking about actually putting the ACE-15 survey tool into use in health centers. So just a heads up, we're recording the session, so that'll be available for you afterwards, as well as a PDF of these PowerPoint slides. So we're going to go through a fair amount of material today, but you'll be able to go back and look at that. And if you have any questions, again, you can put them into the chat box, or you can email Mariah at her email up there on the screen. And then we do have an evaluation at the end of the session, and it really helps us if you can fill that out real quick. It's just a few questions. All right, and then let's go ahead and get into a little bit of an introduction to see who's here today. If you go to menti.com, and you can go on your phone or on your computer. With your phone, if you want to pull up your camera, you can actually click on the QR code up there, or you can go to menti.com and enter the code 74303377. And let's see if we can put that into the chat real quick. Okay, so that's in the chat. I'm going, excuse me, to switch over to the Mentimeter. And when you pull that up, oh good, looks like we got a couple people already answering. So just to get a feel for who all's with us today. And if you have any issues accessing Menti, you can always go on to the chat and just put in, your name and role and how long have you been in that role. I just want to get a feel for who all is here. Okay, so we got quite a few people with a fair bit of experience in their roles. Excellent. Okay. A few more minutes for, a few more seconds for people to put in their answers, and welcome everyone. Yeah, we've got an excellent range of people. Some folks looked like someone who was here, it was in their role about 6 months, and some people with 7 and 10 years of experience. Terrific. Well, thank you everyone for joining today. I'm going to switch back over to our PowerPoint here. Okay.
Alex, I can see the correct screen. Just wanted to let you know just now.
Okay. Yeah, unfortunately it for me, let me go back into this here. There we go. All right, how's everyone? Is it sharing correctly?
I don't see your screen just yet.
Yeah, same here.
Oh, I apologize. I see what happened. Let's do this. Okay. How is that?
Yep, we can see it now.
Okay. All right, excellent. So again, welcome everyone. Thank you for joining us today. We've got a few learning objectives. They're pretty straightforward. We're going to learn a little bit more about what the ACE-15 tool is, and specifically how we're going to use it in our health centers. And we're going to go through a little bit of math, but it's okay. It's not going to be too bad. And then Kathy is going to talk to us about how they've used it in their health centers, and that's going to really help us understand exactly how we're going to interpret and apply those results. So really looking forward to hearing about her experience. Okay, so if you go back over to Mentimeter, we should have another question up there for you. Let's see. And it's, how would you define the term teamness? And I know that's kind of a weird word. I'm just looking for, like, what are other people's takes on what teamness is? So we've got some people saying working in a collaborative way to achieve the same goal. I like that one. Working together. Togetherness, synergy, shared vision, goal directed. We're working together towards a common goal. Cohesion, one unified purpose. Oh, I like that. Trust, that's a big one. Participatory leadership, okay. A group of individuals who work together with the same goal and vision. Willingness to work together when it's not my job, that's always really important. Let's see, non-siloed. Support, working together. Excellent. So we're going to talk a little bit about the I'm sorry. So we're going to talk a little bit about the ACE-15 tool, and teamness is important to that because it's the term the authors of the tool, the creators, use to define what the tool measures. And so when we're talking about what is the ACE-15 tool, it is a mechanism for assessing the perceived teamness of a group, which is really how people perceive their group's collaboration, support of each other, and communication in the workplace. So all of those answers you see scrolling through the Mentimeter there, you all seem to be on exactly the right track. It's how well does the team work together? How well do they trust each other? How well do they function overall? And really what the tool is measuring is how do people perceive that, right? Whether or not the team is actually doing that, as we're going to see, is a little bit different question. The tool is really measuring people's perceptions of how well their team is functioning together, and that's really important to assess. And that's why we're going to use the tool. The ACE-15 tool can be used to improve team performance and create a better workplace culture. And we're going to use it to foster resiliency and reduce burnout. But we have to make sure that we're using it in kind of the correct way. All right, so how does the tool work? Pretty straightforward. It's 15 statements, and participants are going to rank their agreement with those statements. So it's a Likert survey tool. All right, and so it can be taken by members of just a single team, or you can have multiple teams within a group all take the survey, and you can have every team within an organization take the survey. The important thing is that people understand when they're going in to do this survey, what team are they talking about? Are they discussing the organization as a whole when they're making these rankings? Or are they discussing a subunit within the organization? So say you have a clinical team, are they talking about just their, say, patient-centered medical home team, or are they talking about the whole clinic, or are they talking about the entire health center? So we just need to make that clear when we're providing the survey. After your folks have taken the survey, we're going to have to score and interpret the results, right? So participants are going to take the survey, and they're going through these 15 statements, and they're ranking them: strongly disagree, disagree, agree, or strongly agree. And for an example, the question number 10 on the survey is: all voices on the team are heard and valued. So if I feel like, good, I have a voice on this team, I can speak up and people will listen to what I have to say, I'm going to say number 4, strongly agree. All right, so whoever's administering the survey will then take those surveys, and they're going to score each question, and the number associated with that response is going to be totaled up for each question, and it'll give you a score of 15 to 60 for each survey. And so a score of 60 would be excellent. That's across the board. Everyone felt good about how the team works together. And a low score of 15, a minimum score, means like, oh, everything's terrible and no one talks to each other and I'm not even sure we're actually a team. But there's a couple little tricks. So in the survey, to avoid people just going through and, kind of running down the number 4s, and that not being caught, there's some questions that phrase things in a negative way. So for example, team members fail to appreciate each other's values and diversity. That's question number 5, I think. And so these questions 5, 9, and 14, we're going to reverse code them. That means if someone answered, oh, I strongly agree with that statement, that's actually 1 point instead of 4. So not too confusing, right? When you're adding up the scores, basically just go to these 3 reverse coded questions first. So you go to question 5, and if they strongly agree, then that's a 1. If they strongly disagree, that's 4 points. And so you'll just do that for 5, 9, and 14 first, and then you can go through and tally up the rest of the scores as normal. Okay. So we've got each survey taker's score, and we've got all of those collected somewhere. So now what do we do with that? We can look at each person's score, and that's going to tell us a fair amount just in and of itself. That's great to have that kind of individual understanding of how people are feeling about their teams. But it's even more useful if we can see how well the team members agreed with each other. What do they think of the team overall? And even look at different teams and say, does this team have more of a feeling of teamness than this other team? And to do that, we're going to need to do some maths. And it's okay. Some of you out there are probably like really, super into statistics and would know. I had to look up some statisticians' names, but like Gertrude Cox or Thomas Bayes, those are famous statisticians, apparently, according to Wikipedia. But we don't all have to be that level of statistician. This is pretty easy math to do, and we're also going to have some little shortcuts for you at the end. But the first one that we're going to do is take the mean. And I have a little joke down there, which was funny in my head when I was writing this. And now I see it on the screen. I'm like, oh, that's a terrible pun. But how we take the mean is pretty simple. We're going to add up all of the survey scores for our group. And we're going to get that sum. In here, it's the letter S. And then we're going to divide it by the total number of surveys. Right? So if we have a 4-person team, we add up all 4 of those scores, then we divide them by 4. And we got the mean. That's pretty simple, right? I'm sure everyone knew how to do that beforehand. So the next thing we're going to look at is the standard deviation. And that's a terrifying word for anyone like me who has taken very little statistics. But it's actually really important and it's not too hard to do. So it's going to look a little intimidating. There's that formula right there, terrifying, right? But it's okay. There's a key for what everything means. And like I said, we're going to have some online resources where you can actually just put in the numbers and it'll give you the standard deviation. And I also have directions on here, a link to directions for how to do that with Excel. So it's not too bad. You don't have to do all this math, but just so you understand it, we have sigma, which stands for the standard deviation. That's the little circle with the hat on it on the left. And then we have mu, which is, remember, that's our average or the mean. And then we have the total number of surveys taken, that's N. And basically what this is saying is we're just going to, take all of our survey scores and we're going to plug the numbers into this formula. And we're going to look at how much agreement or disagreement there was between each of those scores. All right, so instead of just looking at the average for the entire team, we're going to see, okay, within that average, how far were people's scores from that average? And what that tells us is how well do the team members all agree on their different assessments of the level of teamness. So when you're going through this math, here are some helpful links. Again, you'll be able to get the PowerPoint, so you'll be able to click on these links and actually go there. But there are standard deviation calculators online. There's easy guides if you do want to do it by hand because, I don't know, you're bored. And then there's also directions for how to do it on Excel. And then you can use survey programs like Google Forms or SurveyMonkey, something like that, will usually automatically provide you with statistics like standard deviation and mean.
Alex, I think we have a question before we go on. Amanda from my team, actually, Moody, is asking about whether there was nationally validated. And I seem to remember when they presented it, Suzanne might help me too on the collaborative, that they did say it was a validated tool. But do you have any references on that? Or
Yes, they so the tool has been validated, and I'm going to provide everyone a link to a PDF that actually has the citation for the original study, and I'll provide a link to that study as well on, I think it's ResearchGate. But yes, they did, excuse me, they did validate that. And we're going to look a little bit at the average scores that they got in their validation process so that we can get an idea of, oh, if our team is getting this average score or this kind of standard deviation, what does that look like against a control group? So yeah, excellent. Thank you, excellent question. Thank you. And thank you, Kathy, for letting me know about that. Okay, so if we go to Menti, let's see, some people are probably already on there. There we go. So why is knowing the standard deviation important? And I'll put the code and everything back into the chat in case anyone dropped off of there. Is there a lower literacy? Sorry, we have a question as well. Is there a lower literacy option available for this tool, or is it offered in other languages? It is not offered through the authors in other languages. if you do interpret it for your own internal use, if I remember the user agreement correctly, and again, I'll have a link to that so you can always double check, but I don't think they want you to distribute other translated versions and put them out there, so you can do it for your own internal use, but you can't send them to other organizations. And there's not a lower literacy option available, again, unless you produced one on your own. But then if you do something like that that alters the tool, then that validation that they ran is, no longer applies. So you would just have to do it with that understanding that it may alter the results, because obviously translation is a very challenging process as far as conveying the same meaning. But yeah, excellent question. And certainly an issue when you're doing any kind of team evaluation is not just, comparable literacy rates among team members, or similar grasp of language of whatever language the survey tool is in, but also just how do people perceive the language of some of those statements. And so that's always going to be one of those factors that you have to take into account when you're looking at scores. So we've got some discussion of why knowing the standard deviation is important. So we have seeing the outliers, and also to show if there are major differences between departments. Show how far apart folks' perception of the teamness may be. Tells you how spread out the data is, differentiating scores and outcomes. And does you understand what's a significant difference? Yeah, and so basically we're just looking to see, because we may have a team where a couple people think it's functioning great and a couple people think it's functioning terribly. When you average those, you get like, oh, this team is okay. On average, people think that the team's doing all right. But there's actually a much deeper problem, and that can be a really big challenge, where you may have, say a team leader who thinks everything's going great. My team loves working together. And you have some people on the team who just feel like there is no, line of communication, or the team is very dysfunctional. And when you have that kind of difference, if you just average the scores, you may not pick up on that. But when you see that wide standard deviation, it clues you in on, whoa, there's a lot of disagreement on how well this team is working. And that's something that actually really does need to be addressed to make sure the team stays healthy and functional. So when we're looking at the results, we're going to want to know what was the team's average score. And going back to that discussion of validation, when they validated the survey, they gave it in several different environments and to 192 clinicians. And their average score was 47.7. Now, that doesn't mean that a score below 47.7 is bad and above it is good, but it does give us an idea of what's kind of an average to expect. So the way I would look at it is, if you get a score that's below 40, I'd start to be pretty concerned that this team doesn't feel like they're working together well. If you get a score above 50, I'd be like, this team is probably pretty high functioning. And so that's really good. And then what was the team's level of agreement overall? That's our standard deviation. Well, when they did the validation for this study, what they came up with was 6.4 as an average standard deviation. So that means of the different teams that they analyzed, they had all different standard deviations, but those averaged out to be about 6.4. And so again, that doesn't mean that if your team is a 6.5 standard deviation, that like, okay, they're good or they're bad. It's just like, oh, well, that's kind of close to the average in what a group of people might see as how well their team functions, the difference between those opinions. So if the standard deviation is much lower, that means most people agree, right? So when that standard deviation number gets down closer to 1, that's really good, because that means that, all the team members think the same thing about how the team's operating. So even if they all think it's operating badly, at least they're all aware of it. What I would be really concerned about is when there's really high standard deviation. So when it's getting up, 8, 9, 10, that would really concern me, because that means there's a big gulf between what different people think of how the team is communicating or operating. And that usually means that there's some pretty major communication problems and perception problems. Or you have some people who are perceiving the survey differently, or someone who just checked all fours just to get it done with. So you can kind of look at those things. But that bigger standard deviation is going to clue you in to start investigating a little more. All right, and I'm going to now turn it over to Kathy, and she is going to discuss what applying all of this in the real world really looks like.
Alex, do I have control of the slides now to push them forward?
I don't think I can hand that over to you, but if you want to tell me, I'll just advance the slides when you
Okay,
say.
sure thing. So, you know, we were very grateful. In fact, I have a colleague on the call, Amanda Moody, who was also one of our team members who participated in the Learning Collaborative last year with ACU. And it's one of the benefits of being part of ACU is having this expertise that we're able to take advantage of and hear about all types of practices that could actually help us to look at our turnover rate, our staff engagement, and everything else. And this tool was one of the things that was presented, and we were really excited about it. So let me go to the next slide, and I'll tell you a little bit about, for those of you who might know, Sun River Health is a very large network of community health centers, federally qualified health centers in New York. We have sites, you can say, all the way up in Columbia County, and we go through lots of rural counties, urban counties. We're in New York City and all boroughs, and we go way out to the island to Suffolk County. We have migrant sites, we have homeless programs, and then we just have the regular standard patients. We have about 250,000 patients, and normally we would have 2,000 staff members, but of course we like all of you sitting on this call probably don't have, we're short staffed, et cetera, et cetera. So I've circled Suffolk County because this is where right now all the surveys have taken place so far. Suffolk County has a mix of some urban and some more rural places, and they also recently have really experienced a lot of staff shortages, you know, related to COVID over the last 2 years. Things have been challenging, as I see a lot of you on HR. Pretty much everybody on this call will have experienced that, and you can give me a thumbs up if you agree. Let's go to the next slide, and I'll tell you a little bit more about what we did. So when we first saw this, we thought, oh, this might be, and Amanda, you might have to refresh my memory. When we started talking about this, wasn't it Nadia Arif, the medical director, who said she'd like to test it out? Yeah, okay, she was. So a lot of us thought, oh, this would be useful, but the medical director who oversees the region of Suffolk County said, I'd like to test this out with some small clinical teams. And to be very honest, I'm going to be transparent here. We really didn't know what we were doing at first. And I think I think we know a lot more now, and I can share what I know now, but I can tell you, when you start talking about standard deviation and having me calculate and add all those things, I thought, we can't do it. And at first, we actually weren't able to do it. So we did several things. When we first started this, Dr. Arif said, let me just do paper surveys. And so she handed out paper surveys to several teams. I think there were 7 teams, and they ranged in size from 3 to maybe 8 or 9, I think was the top number. And then we said, okay, who's going to calculate them? We were all short-staffed. We just don't have somebody to sit there and calculate these things. So it took us a little while to realize, one, I developed it just using Google Forms. I used Google Forms and sent it out as a link so people could actually fill out a form and it would be calculated. I then went back when we were calculating, we had to do the reverse questions. Remember those 3 questions that must be reverse calculated? So I went back and did that manually. And I'm going to talk just briefly. There is a great website, and I think it's just one second, it's .net. It's calculate.net, I think is the name of it, and I'll find it just before we leave. And that's, yeah, that's what it is. It's calculator.net. And that's what I use for standard deviation. It's very simple. no problem, because I wasn't going to sit there and calculate standard deviation. The other thing is the last step, and we'll talk more about this in the end, is working with a local team to see how do we develop a plan to act on some of these results, because it makes no sense to actually have a survey if you don't know what's going on or don't know what you're going to do about it. And I think when we look at this, some of the questions that we're asking in the group were respecting diversity and each other. How do we know what we bring to the table if we don't have that trust with each other and respect of diversity? How do we communicate and how do we improve communication? This is a big one for our organization. We have, and this is something for all of you to think about. When we think about communication in teams, we all exist in big teams down to very small teams. We all have issues with, well, I shouldn't say that. Many health centers struggle with communication. How do we struggle at the big picture level? And then how do we work down to the very local level so that my team member knows I'm going to be taking off one day and I need to make sure that I'm covered? Those are some real live issues. And I have to just say again, in this time when all of us are struggling with staff being out, with new staff members being moved to different teams to try to cover shortages, we have to face this in a real life situation. And so these become really critical questions. And you'll see that as I talk about some of our results, some of the current situation has impacted how the teams function. Can I have the next slide? So we had the teams that ranged in size from 3 to 10, and we had the first group fill out the survey. And it does take about 5 to 7 minutes. They do say in the instructions it takes about 5 to 7 minutes to complete. And I do want to take note of the question that has come up. And I think, Kelsey, you brought this up about low literacy and language. This is really important. We had the last team that we did, well, in all teams, we have people who have English as a second language. And when they're doing surveys, it's really important to clarify, especially those 3 questions that are really tricky, to clarify it before the survey occurs. I think it also is important to make sure that we set the stage, and when we're releasing the survey, and the last one we did a better job, I have to say, of a group with that represented health home staff members, health home for Suffolk County. We explained the purpose of this, that we're really doing a PDSA. We also explained to them that this was to try to measure teamness, or how they felt with their own team. And we had to be very intentional about explaining what team we meant. We didn't mean the team at their site, which reflected 50 people. We meant just very clearly their local health home team. So that was really important. And so I'd also recommend, when we get down to the recommendation, again, nobody has time to do hand calculations. So I would say use the Google Forms. I had a little bit of a logistic problem because our email system recognized thought we were spamming. So we had to kind of get that clarified. And then lastly, when we were discussing this, let me just give one break. The last thing was, and when we talk about the breakout and how we handled the breakout, you'll see that we thought we would work in pairs to come up with some solutions for this. But the other thing was to remind you all, when you do give this out to people, to make sure you're clarifying the reverse scores for 5, 9, and 14. And that was it. That was it. So what was some of the reaction? And this is probably, can I have the next slide? What were some of the reactions? And maybe that's even, maybe I'll follow that with this. But you could see from our graph, this is our team ACE scores, and I plotted everybody. And how when you look at the standard deviation, the higher the standard deviation, the more it tells us that this team is not all on the same page, and the higher it is, the more likely that those results are not really correct. So it means that in and of itself is really an indicator for need for help. You also look at, when teams feel like they're really performing well, but there's a higher standard deviation, it means that, not everybody on that team agrees that the team is performing well. And you really want to make sure, since these are very small groups, they're really 3 people to 10 people. If you have 2 people that are really not in agreement on this, that's a pretty good issue. That's a pretty important issue to look at. So you could look at their, over the, pretty much in different places. We didn't draw the thick line to say, okay, above this line, you're doing good, and below this line. It really, that may come later as we do more teams, but we wanted to see how, kind of how it was flexing. I did notice the last team that we did, which is on the top, number 1, the group number 1, that when we only had 8 people who had completed the survey at first, and it really had a much higher standard deviation, and it actually straightened itself out once we had 2 more members. So the bigger the group, I have to say, you're a little bit more likely to have, I think, more solid results. So even though 3 people is not too little, I would still say try to get more people if the group is, try to get as many people from that team as possible. All right, I did share with this specific group when we were working out this PDSA. And by the way, the plan, I think everybody knows on this call, that's the Plan, Do, Study, Act. We're looking at how using this tool might be helpful, and what we might be able to do to make it more helpful. So let's go to the next slide. Let me tell you a little bit about what we did. We explained to the people, and Ahmed, I'm going to get back. I mean, Asma, I'll get back to you about that, because that's a very good point about safety and filling out this form. So I did go over a little bit about that their score wasn't bad or good. It just carried this, that we were looking at this, and that there was no kind of evaluation of them, because we did want to create this safe environment where people felt they weren't being chastised, especially the supervisor who stepped forward and said she really wanted this to be done. This is just a description of how you look at this, how you might look at what the standard score is. I think Alex did a great job on that. So let's move to the next slide. So what we did, and this might have been probably the most important kind of aspect of this work, in that it led to a deeper discussion. I think any survey is as good as what leads up to it and what comes afterwards. And I'd have to say that we do an annual staff satisfaction survey every year, and it's a massive thing, and Amanda can attest to it. It's not fun. And everybody on this call probably has been through that. The good thing about this is that it's much more targeted. You're working with a small group, and you're asking them these questions that I think are really important. We broke up in groups and asked them to come up with ideas that might improve their team. And it was really helpful to hear their insights. One of the people said that people might be reluctant to be honest and express this, to express themselves, but that this smaller survey made them feel a little safer in a way because they trusted the people on their team. I thought that was a good thing, because it really does. It's really important to set the stage for people to feel like they can really come through. I also think that when you're talking about this, to ask people to think about how do they fit in with the bigger system, because sometimes the problems that they expressed were also sometimes communication that goes on outside their team. So it really was a great learning experience. I'd have to say that coming away from this, some of the things that I've already talked about, but also making sure that we're following up on this. So what the plan is, we're going to try to do this to have a meeting every 2 months and look at what we've been working on so far, because we're not going to do a lot of things at once, but we're going to do a couple of steps at once, and the team is going to work together on this. And then we're hoping in about a quarter, about 4 more months, to come back and measure the sense of teamness again, to see, is there any change? Do people feel any different? because I have to tell you, even though the score, was just under 46, one of the things that came out of this was that sometimes people are not able to fully express themselves, maybe because of, limited English, or sometimes because of their position, but that this group dynamic starts to shift and change when you have them work on a group function that's very close to their heart: trust, clear roles, respect. These things are deeply tied to who we are. And I think at no time have we ever experienced this in healthcare, that we need to have our teams feel very much that they're connected to each other, because that, we need each other to get through all the challenges that we're facing. And I think this survey, while I don't know if I'd rate it as the top 10 in my whole life that I've ever seen, but I thought it really stimulated some good conversation at this level. And the value of this survey may be that it helps to launch some of these deeper discussions, and it may bring out, better work. Now, I do have our staff satisfaction survey results that I can look at some of the Suffolk County team members, and I'm actually going to look at, does it have any correlation between the larger staff satisfaction data? But I'm really thinking that the value of this tool, because of its kind of a small targeted focus, may be in that it helps the team members to really have a better conversation about how they can enhance their teamwork. I don't know, I'm trying to think if there's anything else, and I think maybe opening it up to questions might be helpful, because I'm thinking I wanted to just make sure that we, spoke about those major things and how useful I felt. And Amanda, I don't know if you had anything to add or if people have questions, but I think we can open it up.
Yeah, absolutely. And you do have one comment from Asma, who said that I'm glad that the team of 3 to 4 people felt safe to share how they felt, even if it, may not have been great news, kind of depending on the score. And I think that's a good
And
point.
Asma, I did want to come back and say something to you. Whoever's administering that probably should take a temperature of all the teams, because there may be teams that don't feel comfortable and safe in doing that, especially with tiny 3-person groups. So I'm glad you mentioned that. In this case, it was. I think we felt comfortable, but it may not always be that way. Especially if you have a team that has a lot of turnover, a lot of things going on. What is going on with this team? This tool may be really helpful in kind of looking at that and kind of digging a little deeper. Anybody else?
If not, I have a question. Did you consider whether to make the survey anonymous at all, or was it just kind of presumed from the start, like,
It was, the problem when it was handed out, they didn't put their names on, and I had no idea who it was, and it was scored by somebody who was separate from the site, so it was anonymous. But I like the idea of the Google forms, because I made it so that it wasn't collecting who had completed it, because I feel like there needs to be some anonymous protection in there. I do think, and when you do a handwritten copy, people know who wrote it. So I think that's another reason Google Forms is a good idea. Amanda? Oh, and this is a good point, I think, for Michelle. When people don't feel safe in saying something, this was really important. So the timing, we did our survey in April of 2021, and some of the surveys were done in June. Might have been, I think most of them were June, and then this month we did it. Amanda's having technical problems, but you know, Amanda was part of the team. We had about 5 people. Now, I forgot to mention one other thing, Alex. We have, our HR department was not able to participate in this learning collaborative, and we really felt this was such a great tool that one of our HR folks that works with teams is actually, I'm going to be showing her how to use this, because we really think this is in her tool chest, she'll be able to use it. So for those of you that are in HR, you know, you might want to consider that. Did I answer those questions? So the staff satisfaction survey. Yeah, that was done. And then, you know, so the health home survey was just done this month. So, you know, it's going to be rolling. Any other questions or thoughts? I'd love to hear if people think they could use this in any way. You could use it in dental. I saw somebody from dental. You could use it in a lot of really any department. And even though it says clinical teams, I did use it in the, you know, I think you could probably use it in an administrative team too. Okay,
Yeah, I think that's it. And that was, you know, some of the things that I wanted to make sure to cover, like you talked about, is like, are these here? But yeah, I think different teams, you know, it was validated with clinical teams, but I don't see any reason it wouldn't be a great thing to use with, you know, administrative and other teams. Oh, and let's see, we have a.
Okay, so there's 2 questions. One about the staff satisfaction. I am going to look back. I can't do it for all the teams, but I am going to look back for the Suffolk County clinical teams for the sites to look at how they scored in the staff satisfaction. The only problem is it's not, it may be all the people from their site that were a part of a clinical team that respond versus just those kind of small teams. So it may not be apples to apples, but we are going to do that. And then the other thing is the follow-up. And somebody, I think somebody who was saying, how do we do it? So on the intervention planning, when we met with the full team, we felt that some of the conversations were really helpful to begin. And some of them had said clarity with, in fact, I have to write up my my notes on this, some of this. They would like to have some more work done on communication externally away from their team, because they're feeling that it was impacting their own team, which was a team within another health center. So that was one thing. And they also talked about, you know, with team building activities, that is an important part of a whole comprehensive, right, the comprehensive work that we're doing. And that will probably be in the plans as we go forward, you know, because this is a long-term process. I don't think this is, you know, you don't change a team dynamic within a week, 2 weeks. This is more about an ongoing thing. But I think there were 3 categories that people felt that they could work on, and that was part of our plan for that group. So every team may have their different plan based on what they're feeling. But that was, you know, we also talked about the challenges, to be honest. You know, some people work remotely, some people work on site. And it's been a challenge to feel so connected that we used to feel much more connected to each other. And the clinical teams, for the most part, are on site, and they might have less of an issue with that, but they still suffer from some of the telemedicine, the days that we do telemedicine, and, you know, people are off site. So there were some added challenges that we have to try to work through. So I don't have those answers yet. I'm hoping that over the next year, especially with some of the smart young people like Amanda and other folks who are working on how do we make changes in our culture as it shifts every day.
Yeah, and your responses and people's comments kind of led right into the final takeaways, which, you know, I think what you did is the follow-up, because surveys without a follow-up are, you know, kind of pointless, and bringing people together and having them talk, I think is a really good starting point, especially for something like this ACE-15 tool, which, what doesn't it do? It doesn't show exactly what the problem is in a team. It just lets you know if there's different perceptions of how well the team's functioning, or if people don't think it's working well. And so just asking people, you know, when you can convene them like that, I think that's a really great mechanism. And then, yeah, communication. I thought that was interesting. Some people felt the need for better external communication, and felt like that was affecting their team. That's something that I think is easy to overlook, but is really important as well.
It was interesting because this team was a health home team, and they work with, they work with people who are also, they work with another team of case managers who are working with people with HIV. And sometimes the scope of practice is a little different for each one. And it causes issues if people referring in, the clinical teams don't know what those people are supposed to do. It causes issues for patient interactions and also for health center operations. So I thought it was very helpful to have those deeper kind of conversations.
Mm-hmm.
Was there another question that came up, I think?
I don't see a new one yet.
Okay. It'll be interesting to see, though. I think this, any other questions will be interesting to see what happens in a year, how many more we've done. I can't see doing it for all our departments, but I can see that this might be a useful tool. We've been asked to do a few departments. I think there's there are two on the waiting list. So
yeah, and I think also your point about potentially doing it multiple times, resurveying the teams later on to either as a benchmark to see if interventions have helped, or just to to kind of re-gauge and see if maybe once people understand the survey, because going through the survey once, obviously you know a little bit more about what it's asking, and you may have thought more about what those responses would be, and it may affect your responses, or you may feel more comfortable giving a little bit more forward or upfront response.
any other final questions? Anybody have anything thoughts about this? Great.
Well, excellent. Well, thank you so much, Kathy. That was terrific. Really good to hear about that. I think you guys are making excellent use of this survey, and yeah, hopefully some of the folks that joined us today will be able to take this and use it well.
Alex, I just thought of one quick thing before we end.
Oh, yeah, absolutely.
So when we were talking about this, we were also talking about the stay interviews, and ACU has done a great webinar and has a lot of great materials on that. And I think it was Suzanne, or maybe it was somebody was telling me that, maybe it was Marisol, that this was one of the biggest areas that people keep on asking for. But it had some questions that were asked of people about what they value, and I thought that this almost has some kind of crossover with this kind of survey, that it might almost be something you can look at while you're doing this. So it'll be interesting.
Yeah, absolutely. And yeah, there's lots of opportunity with this tool. It's a good opening point to a lot of work that can be done to help teams kind of communicate and function together. Even high functioning teams can always use some understanding of where might we be able to improve. So Excellent. Well, if there's no more questions from anyone, I think we will get wrapped up. Can I ask everyone to please fill out the poll that's going to pop up on your screen? We'll do a little survey. There we go. That should have come up here. And that does really help us out. I know survey fatigue is a thing, and we've just talked about surveys for an hour, but we really appreciate everyone's responses. And thank you everyone who was able to attend today. Oh, and real quick, while everyone's taking the survey, I am going to, well, I may have to stop sharing my screen here, but I'm going to put a couple links into the chat for everyone. So this is a link to the ResearchGate article that the authors of the study published. And oh, thank you, Asma. I'm sorry. Yeah, that's my get vaccinated, don't get COVID chalkboard drawing. But let's see, and then the actual tool itself, with the instructions and the use agreement, is available on this link here. And you can always find it just by Googling, just by searching ACE-15 survey tool, and links will come up. So it is out there and readily available.